With dental implants, if you're only missing one tooth, why get a dental implant over like a bridge? What's the advantage?
Well, first, one of the most emotional things I think people can go through is losing a tooth. I mean, there really is an emotional connection there. And I see my patients go through that routinely. And some say it was my biggest fear and it's happened. And it's a hard thing to get to. Now, when we talk about what happens when you're missing a tooth, without that tooth there's ramifications. We have issues with bone loss and the way that you're able to chew your food, beyond just the aesthetic component of having a tooth missing. So traditionally, our replacement option was a bridge. Bridges are great, we do them still, but the problem is you have to grind down the teeth next to where that tooth is missing. You put the bridge on, lasts about 7 or 8 years, but you just turned a single tooth problem now into a 3-tooth problem, because those are forever connected.
Okay.
So the dental implant gives them the ability to replace just the missing tooth, so we replace what was missing, with a great replacement option that looks, feels, and acts just like a regular tooth. It's going to give you all the aesthetic functionality that you want out of a tooth, be able to eat whatever you want to eat, and it's going to preserve that bone.
How long does it last?
It should last a lifetime. The nice thing with dental implants is they don't get decay, so that's not an issue anymore. Gum disease is still a concern, so getting regular cleanings, regular checkups, taking care of it's important.
What about pain? Seems painful.
So, my patients, I have that question asked to me every time, and I can tell them, because I get all the patients tell me this. They're like, "Doctor, that was easier than having a crown done."
Okay, so pain should not keep them from doing it.
I
Now,
hope
you
not.
have oral sedation. I guess you're licensed for also IV sedation.
Exactly. I give my patients all the options. So I have patients that say, "Look, I want IV sedation. I want to make sure I'm not aware of anything going on." I have others that say maybe a little laughing gas and oral sedation can work. And then I have others that are much tougher than I am, and they say, "Look, as long as I'm numb, I don't feel anything, do what you got to do." So I let my patients dictate what's going to work best for them.